Hi, and welcome to YMyHealth. I'm Julie Woon. I'm one of the co-hosts of the YMyHealth podcast. And today I am here with Ben White from Fight CRC, Federal Policy Manager. If you listened to one of our past episodes, we've talked to Ben before, but today we are in person to do a podcast recording, which is very exciting. So nice to see you in person. Excited to talk today. And today's going to be a little different from the last episode because we're going to talk about your personal experience with colorectal cancer.
Yeah, thank you for having me. I'm really happy to be here again.
Awesome. So I just want to start because for you, you were diagnosed very young, 26, I think, right?
Yeah.
And at that young of an age, a lot of people say you don't have colon cancer, you're too young for that. So I wanted to see what advice you might have for young people and, listening to their bodies and maybe advocating for themselves if they think something is wrong.
Yeah. So if any listeners have listened to any of the other podcasts with interviews with early onset colorectal cancer survivors and patients, it is really, really hard to get a diagnosis. And when you know something is wrong, but your doctor tells you everything's fine, it's challenging. I mean, speaking from my own experience, like I was conditioned to like believe what the doctors are saying, not to be like, no, like my doctor's not wrong. And it took a lot of returning and a little bit of luck. It took for me basically one doctor who was an advocate and basically said, no, go back. Like something is not right. My flight doc at the time basically was like, hey man, like if the ER kicks you out again, like go to a different hospital. I'll deal with the paperwork of you going somewhere where maybe you're out of network or whatever. And that was the difference for me. And I'm also fortunate to come from a family with a medical background. Both my parents are nurses. My sister's a nurse practitioner. So again, them telling me, hey, this is not normal. And I recognize like not everyone has those advocates in their ear. But don't be afraid to advocate for yourself. It's hard though. It's not easy. It's easier to say like advocate for yourself than it is to actually do it. So I think the biggest like advice I would have is just as you're listening to your body and as you are feeling like something is wrong, pursue that. Like don't just take like no for an answer.
Yeah.
Sometimes you have to get a second opinion. Sometimes you have to go somewhere else.
Yeah, I feel like we've heard that several times from different experts of if somebody doesn't listen to you, try again. And that's frustrating, obviously, but it's your health, like it's one of those things that it's worth pushing for. So absolutely. And what was the first moment that you realized, hey, something might be seriously wrong?
I had a hard time and I want to say, I don't think there was like a single moment, right?
Sure.
So for those listeners who listened to the previous podcast, they may have heard this, but I was active duty. I was an aviator at the time, naval aviator. So it was, a lot of the symptoms were slow. Also, like I never had blood in my stool. I had a narrowing of stools, but that was over, looking back, I realized, a very long period of time, right? It's like, it's such a slow progress that you almost don't notice. The big red flags that started were, I started to have a lot of abdominal pain, cramps. I was waking up in the middle of the night to go poop. Like that's not normal. Like you shouldn't be pooping that many times a day. Waking up in the middle of the night, things like that. And I'd even started to lose weight, but all of this was really hard for me to kind of catch because there were things in my career. Like I had just gone to, the Navy survival school where I like basically didn't eat for a week. So I was like, well, yeah, of course I'm losing weight. And of course, like my body's readjusting after these kinds of things. And it's a high stress job. So there was a lot of easy ways for me to explain it away until basically it got to a point where I had been visiting my doctors and, it was a very slow workup until suddenly it wasn't. It was like, oh, I'm really losing weight. I am like waking up in the middle of the night in pain. I am like all of these things. And so, yeah, it wasn't like a one, like, oh, I looked down and there was blood in the toilet moment for
Yeah.
me.
Yeah. And I did want to talk about your Navy experience a little bit because you were medically separated from the Navy right after this diagnosis. And so I wanted to see how that maybe changed your sense of identity and your career aspirations.
Yeah. I mean, the whole diagnosis was like, I don't want to go too much into the details because I could probably spend way too long talking about that. But like the long and short of it was that like I wasn't diagnosed until I had an emergency surgery. And so I essentially woke up from what was supposed to be an exploratory surgery with an ostomy and a cancer diagnosis.
Wow.
So there was a lot of like shock to that, which obviously like a cancer diagnosis in your 20s is always shocking, but like the nature of my diagnosis was very, very challenging. And then, yeah, I mean, I had spent years of my life training towards this goal. It was my identity. Like it was, I missed weddings, I missed birthdays, I missed holidays with my family to, be in the military. Like, and to be told I could never fly again, to be told that was done, it was heartbreaking. And it for sure took me some time to kind of like forge a new identity, I think,
Yeah.
after that.
Yeah.
And it's still challenging sometimes when I look back and I'm like, man, that was like years of my 20s spent doing this thing that just like very quickly disappeared. Um,
So that's obviously very tough, right? Like this is a shock to you, something that's not really expected. And I mean, outside of just the shock, I mean, the diagnosis and ongoing, what strategies did you use to cope emotionally and physically with that diagnosis?
it was especially hard because at the time I was living in Jacksonville Beach, Florida, which is I grew up in California. All of my support is on the West Coast. And I was living with 3 other aviators who, like, their days and nights, like, our schedules are odd hours. We're flying night flights, flying morning flights. Like, it's not like there was a care support system in place for me. I'm really fortunate. My family took turns coming out to visit me in Jacksonville for the first couple months while I was in the hospital. So when I was diagnosed, as I mentioned, it was basically an emergency surgery, but the workup was slow. I'd spent like a week inpatient. My tumor had fully obstructed my colon before I was diagnosed. So I was on TPN, which is IV nutrition. And basically, like, we knew something was wrong, but we couldn't tell. And so I was stuck in Jackson. At that point, my family they knew something was very wrong. And my mom flew out for a couple weeks, swapped with my dad, who came out for a couple weeks. And my big sister had a planned job move and had given herself time off in between. And her plan was to go to Europe. And instead, she came and spent like a month with me in Florida. And in that time, the Navy actually put together a move to get me back to California because the reality was that, like, I didn't have a support group to, like, I couldn't drive myself to and from my, chemo and things like that and all these surgeries. Like, I really wasn't able to take care of myself at that point.
Yeah.
Um, and so my sister and I loaded up the car in between rounds of chemo, and my dog and my sister and I drove all the way across the country back to Northern California. And so that was helpful to have the family support. And then when I got back to California, I was lucky that 2 of my like best friends from growing up, 2 of my best childhood friends, had recently moved back to my hometown. And so I got to see a lot of them, and they had started this passion project, I guess we'll call it. And it was called PAIR, Positive Engagement and Response. And so we started basically a little company and made these like conversation cards that are all about like positive conversations. So think like the like anti Cards Against Humanity.
Hmm.
And so they had like already kind of started working on this when I moved back, but they kind of brought me into the fold. So it was great to have something to like work on, something that was like super about positivity and like thoughtfulness and mindfulness and gratitude. And so unfortunately in the years since, like, our careers have taken us separate ways, and Pair LLC is no longer around anymore. But I did bring you a set actually because
Amazing.
I have like a box of them left in our basement.
That's so awesome. Thank you so much.
Yeah. So that was, I think, like, it was nice to be around people who I loved and who loved me. Like, that was
Yes.
huge for me. And to have my 2 best friends like focusing on this thing that was all about like positivity and like in a healthy way. Not like the toxic positivity, like everything's gonna be
Yes.
fine, but like thoughtfulness and mindfulness.
Yeah.
And I think that was really helpful for me.
You know, we touch on support systems. You've talked about yours. What is, I guess the importance really of having those support systems during that time? I mean, I think most people, they'll come a little bit to the conclusions of like, yeah, having somebody help you get to your doctor's appointments and stuff like that. But really, like, how meaningful is that to have a support system? And you had a very robust support system.
I don't think I could even put into words how meaningful it is. I mean, it's so much more than, yes, there are the logistics of it. So like, I can't drive myself home
Yeah.
after my treatments and things like that. But it is more just like a cancer diagnosis at any age is very challenging. But for me, like we've talked about, I knew that my career was over. I knew that like I basically like got sick and had to leave my life behind.
Yeah.
And I knew that I wasn't going to return to it. It took a while for the Navy to like go through the formal steps. But like when I woke up from that surgery, it was like, okay, well, my career's over. And so having people around to remind me that like my life, for me, my life wasn't just my career. Like I had committed a lot to it, but there's a lot of more things that I loved, and like having that support was huge. And I mean, for anyone though, like looking down the barrel of that cancer diagnosis is very scary. And there's a lot of anxiety and a lot of mental health hurdles that come with that. So having that support network is, I truly cannot put into words how valuable it is.
Yeah, absolutely. And, since that time, you've now stepped into this role as federal policy manager for Fight CRC. Can you tell us how you got connected with them?
Yeah. So I initially met Fight CRC actually through the Colon Club.
Mhm.
So at the time, they were separate nonprofits, but they had a very close partnership. And the Colon Club is now has now merged with Fight CRC, and it is a specific kind of awareness piece for the early onset. And so it started like 20 years ago. The founder, Molly, was diagnosed with early onset, and her doctors were like, "You're the only one. This is an anomaly." And she was like,
Mm.
"Bull. Like that is not true." And she found other young survivors across the country and brought them together to raise awareness. And it has evolved in many ways since then, but it still really carries that heart of like highlighting the patient, the survivor, the caregiver aspect of like the early onset piece. And so I was a colon clubber, a model, whatever we want to call them at the time, in 2018. And as a part of that, with their partnership with Fight CRC, they provided support to come to Colon Congress in 2019. So that was kind of my first intro into Fight CRC space. And so, yeah, I came out and came to a Colon Congress, which is like very full circle because we're here for
Yes,
Colon Congress now. So
that really is. I love that. And what motivates you to continue advocating for colorectal cancer and, yeah, early onset colorectal cancer?
I'm angry. Like, honestly, I lost a lot, and
Mhm.
it took a lot from me, and I'm still, it's been 7 years now, 7 years cancer free. Um, but I don't want other people to have to go through this. And it is so frustrating. Over and over, you hear the stories of people who were misdiagnosed, and by the time they were diagnosed, it's caught in late stages. And we shouldn't have to deal with this. And so it is a I'm so frustrated that this is still a thing. That Molly over 20 years ago was told you're the only one, and me 8 years ago was told you're an anomaly. And it's like, I'm not. We are not. This is happening, and people need to know about it, and we need to start catching it sooner and finding cures for it.
I love that you said that, and thank you for your honesty, because I think you hear a lot of times when people talk about advocacy, you know, uh, people try to keep it, I think, really positive, but, having a diagnosis like this, it's not all positive. Like, there's rightly feelings of anger and frustration and sadness, and so, that is also a very, I guess, like, motivating force in
Yes,
something
absolutely.
like this.
Yeah.
So I'm so glad that you mentioned that, because I think it doesn't get mentioned enough, but it's a very valid reason to be
Yeah.
motivated and to be out advocating, because it is ridiculous that the, standard testing age is still so high when we know there's so many younger people that are getting this diagnosis.
Right. And I mean, the like scientist in me is like, well, the data does not yet support the lowering of the testing age. But that said, there are a lot of things we can do to make it easier for those of us under that testing
Yeah, yeah,
age to get diagnosed. Like there are so many more things we can be doing um, that I don't think we're doing well enough yet.
yeah,
Um, and I think the data will probably soon support another lowering of that age and support that like cost benefit.
yeah.
But yeah, I mean, it's not like I wake up Hulk mad every day, like, but it is a driving force. It is this constant, like, I'm never going to not be angry that I had to go through this, that I like lost this thing that I love, which was flying helicopters and all these things. And like, you know, now my life looks very different and I'm love what I do. But that's always going to be a driving force.
Yeah, absolutely. And it takes a while for the data to catch up. I mean, that's one of
Right.
those things that it takes time to collect data, it takes time to go through it and analyze it. So, yeah, I think you're right. It's just a matter of time, I guess, until we get new stats and see really how things have changed
Right.
over the years. Um, you've talked a little bit about this now that you have a job that you enjoy, but I was going to say, just in general, what does survivorship look like to you now?
Honestly, I mean, it was a lot of reinvention for me. Like I kind of had to start over fresh, right? I like left Jacksonville and it was like very abrupt. I left that entire life behind. I left the Navy behind, and the Navy took great care of me while I was sick. And then basically once I finished treatment, I like worked on the process to get out, and it was like, okay, now what? Like
Mm.
realistically, like my cockpit skills did not like translate that well to like a different real world job. Um, and so I kind of had to start over. And so it's really just been a lot of figuring out what my life is now. And I think that that's pretty well established at this point. So, in 2019, actually, pretty shortly after calling Congress was when I decided DC was on my short list of like, I want a fresh start. I know, my undergrad was in political science and communications. And so like this made sense. I knew I wanted to get a master's degree in public policy, and getting to come out, I spent like a whole week here for calling Congress. I spent time on my own and visited friends, and that was kind of like the final deciding factor. That was like, okay, I think I'm going to do DC. And so I moved out here. I actually got a job with not Fight CRC, a different cancer nonprofit at the time, cancer support community. They do really great like psychosocial support. So definitely going to plug them. So I worked for them for about a year before I went back to grad school. Got my master's in public policy, and then stayed in school forever. And now I'm getting my PhD.
Yeah. Lovely. And what do you want people to know about colon cancer, especially with young people?
That it is not an old person's disease.
Right.
I mean, that's like, it can happen to anyone. My big thing, so when I was diagnosed, I was very open and I shared a lot on social media right away. And I think my driving, like my motivating factor behind that was that like, once I started learning the stats about how it's on the rise, I realized that like I'm probably the first one that people in social media or my network will know, but I don't think I'll be the last. And as I've gotten older, now that it's been 8 years, it is so often that someone comes to me and it's like, oh, like my sister's best friend or my cousin's spouse, whatever, like it is on the rise. And people need to know that it is a real thing that our generation is facing.
Yeah, absolutely. And what would you say to somebody who's just recently been diagnosed?
I'm sorry first. That sucks.
Yeah.
But my big advice would be to find support. I talked a lot about my personal support, but also I think finding peer support. Like I mentioned, at one point I was told like, I was an anomaly, like many of us are. And I knew that that was also not true. And that was how I found the Colon Club. I got on social media and I started connecting with other young survivors, and eventually, found my way to the Colon Club. And even, the relationships I built with people who I've still never met in person, but who were diagnosed with a similar diagnosis to me at the same time and able to kind of share back and forth, meant a lot. And I think helped to know that it wasn't just like me in this box going through this thing that nobody else in the world, like, it definitely helped with like less pity parties. I think it
Yeah.
was like, no, I'm not the only one. And like, I can talk about this with a friend who,
Yeah.
even though I like, they may live across the country or the world. In some cases, I connect with people or not connected with people internationally. It was really helpful.
Yeah. Just to have somebody who understands your perspective, knows what you're going through,
Exactly.
at least to some extent, right? That makes sense. And after all your years of personal experience, advocacy experience, professional experience, um, is there anything that still continues to surprise you about colon cancer and, the space, I guess?
That's a good question. Surprise me. I think it's just that nothing has changed. So I was diagnosed now 8 years ago, and I had all the same questions we're asking. Why is this happening to younger people? What's the reasons? And I would have thought that almost a decade later now, we would have had some answers, and we have had some small answers. We know that like as far as like the actual disease, early onset is the same disease as later onset colorectal cancer. There are some things that have been done, but I am surprised, I guess, frustrated maybe is another word, that like I feel like we're still in the same place we were 10 years ago with this, but it has gotten worse. And we've not made enough progress. We've not had enough research funding. We've not had enough support to look into this. And while that's been happening, our cohort has been dying. And so, I mean, that's why I do what I do. And that's why I decided to continue staying in school and why I'm working on a PhD, because I'm tired of waiting for somebody else to do it. I mean, I'm not going to be doing bench science. I'm a policy person. But I'm not going to sit around and wait another 10 years while more and more people under the age of 50 and 45 continue to die of this disease.
Yeah. And, we've talked about a lot today, but is there anything that I haven't asked you that you feel like is important to note?
Nothing you didn't ask me, but I think the biggest thing is just that, like, you're not alone. You're not crazy. Like, go to another doctor. And if you do get a diagnosis, like, find some support. There is nothing worse than like being told that like you're the only one facing this. When there is such, unfortunately, it's a huge community of us, but that does mean that there are people who can provide peer support. There are people who may be done with treatment who can kind of be there for you and give advice. There are people who maybe have insights into like what clinical trials they've done that might be useful for you as you're looking for your next, course of treatment, things like that. So connect with the community is just like the last thing, which I already said, but like it's the most important thing.
Yeah, absolutely. Well, thank you so much for coming on the podcast again and for speaking with us. We really appreciate it. And yeah, I think we'll see you out on the hill a little
Yeah,
bit later today.
excited to be there.
Cool. Thank you.